How much money do dentists make? Hey guys, I'm Dr. Avi. In this video, I'm going to share with you guys different pay structures for dentists, which ones I prefer, and how much money do dentists actually make. So the public perception is that dentists make a lot of money. In reality, it's not as lucrative as you may think. Yes, dentists definitely have the ability to have a work-life balance. A lot of dentists usually work 4 days a week, and they still make a good amount of money doing so. I'll be the first person to tell you that if making money is your priority in life, dentistry is not for you. There are so many other ways to make money out there that don't require nearly as much debt or stress. Dentistry is not worth your time and stress unless oral hygiene and dental care is a passion of yours. Go watch my YouTube video on why I chose to be a dentist. It's gonna give you a better idea of what it's like to actually be a dentist. All right, so let's talk about this realistic pay structure that you see in dentistry. For this video, I'm gonna be focusing on dental associates and how much money they make. When you compare the incomes for dental associates and dental practice owners, on average, it is going to be less for the associates compared to the owners. And their pay structures are going to look something like the following. So for the pay structures, you're going to have a daily guarantee or a percent of what you do. Whichever one of the two is higher is what you will walk away with. For daily guarantees, those depend on your situation and what you negotiated with the owner. The daily guarantee can be anywhere from 3 months to your entire time of employment. This is a must-have in your contract because it incentivizes the owner to ensure that you are successful at the practice, and it pays you for your time as a dentist, regardless of what the schedule may look like. Okay, comparing the daily guarantee to the percent of work that you do, that can be broken down into percent of your production or percent of your collections. Production is the dollar amount of work that you actually do. So of that, you will get a percent of it. And on average, you will see anything from 28 to 33%. Let's say you do a filling for $100 and you get paid 30% of your production. You produced $100 and you get 30% of that. So you get $30. Now compare that to collections. Collections is the dollar amount that the office collects for the work that you do. Let's use the same example of a $100 filling being paid on 30% of collections. Now for that filling, let's say the insurance covers 80% of the treatment. That means that the patient is responsible for the remaining 20%. So at the time of the procedure, when you complete it, the patient will pay $20 for the $100 filling. And now the office is waiting for the remaining $80 to come from insurance. So in this situation, the office has collected $20. Now you get paid on a 2-week basis. So on your next paycheck, you will see 30% of the collected amount, which is $20. And now you have to wait for insurance to pay the rest. Insurance usually takes a couple weeks to about a month. So have fun waiting. When that money is collected from insurance, then you get paid on it. This is when it gets messy, obviously. So as an associate, you have to trust that the office is collecting everything. And that's not how it works. It is rare that you will find offices with a 100% collections rate. You have to just accept that you are not going to get paid for everything that you do when you fall under this collections model. So as a dentist, you get to do work and not get paid for the full amount. In what other industry does this actually work or make any sense? Unfortunately, dental practice owners don't have a choice. This is the business model that they have to be part of. They have the flexibility of getting creative with the way that they collect, but this is pretty much the standard. Associates, however, do have a choice. Associates have no control over the billing or the collections. They can only control what they produce. So it makes sense that an associate should be paid on production. I've been paid under both models, production and collections. While I understand that owners want to pay out on collections, as an associate, I prefer to be paid on production. It's just easier to track and manage. I do work, I get paid for it. That's it. All right, so we just ran through the pay structure. Let's do some math and put it all together to see how much dentists make. Your average associate in a good practice is gonna produce around $3,500 a day. That comes out to $56,000 a month and $672,000 a year. I told you that range of percent that you would get paid on is 28 to 33%. So let's go right down the middle and say this associate gets paid at 30% of production. 30% of $672,000 is right around $200,000. Again, this is an average number for dentists that are just doing basic dentistry, meaning just some fillings and crowns, no expanded procedures, nothing else. So you have an opportunity to actually increase your income if you take the time to offer more procedures for your patients. The more procedures you offer, the more you're able to do, the more patients you're able to treat, and the more money that you will make. So dentists get a really bad reputation when it comes to upselling treatment to patients. I've seen it with my own eyes in some of the practices I've worked at, and if you're a patient, you have to be careful. Look at Google reviews, ask friends that have good dentists, and find somebody that you can trust. And for my dentists out there, as long as you have the patient's best interest at the top of your priority list, and you're delivering high quality treatment to them, you will be able to be successful and make enough money to pay off those student loans. If you want to learn more about student loans and how to pay them off, I have a YouTube video on that as well. Be sure to check it out. If you enjoyed this video, please drill that like and subscribe button and share this with anybody that you think it may benefit. Thanks. Have a good day.